Today we're talking about how to go from feeling anxious and unsure about your first psychiatric visit to feeling calm and confident. I know it can feel a little bit overwhelming not knowing what to expect, but by the end of this video, you will feel fully prepared. We will cover what really happens during the first visits, what questions you'll be asked, and also how we work with you to formulate your treatment plan. And the way we do this is through a point of view immersive experience of my usual psychiatric eval and my practice. I'll use a sample patient who has general anxiety disorder and also major depressive disorder in this example. There will be 3 parts to the interview. The first part is the social history, and the second part will be the evaluation, and the third part will be the treatment plan. So if you've ever felt nervous about seeing a psychiatrist for the first time, stick around. I'm here to make sure you walk in feeling informed and at ease. Hi friend, my name is Jeff and I'm a certified psychiatric physician assistant living here in New York City. My job is to diagnose and treat mental health conditions. In this channel, I share mental health education and also evidence-based self-improvement strategies. So if you're new here, please consider subscribing. Let's jump right into it. Hi, how are you? My name is Jeff and I'm the PA at the practice. Nice meeting you. Yeah, so I'm gonna ask you some basic information first and then we can dive into what brings you in here today. Is that okay? So what do you do for work? Cool. And who do you live with? And are you seeing a therapist currently? How often do you see a therapist? Okay. And do you have any medical conditions that I should know about? For example, do you have any past history of seizures, any heart diseases? No. And what are your height and weight? And do you have any family history of mental health conditions? Okay. And are you currently taking any psychiatric medications? No, you're not. Okay. And have you ever tried psychiatric medications in the past? No, you haven't. Okay. And do you smoke any cigarettes? You don't. And what about alcohol? Just drinking socially? And do you use any recreational drugs like smoking cannabis, for example? No. Great. Yeah, so how can I help you today? Okay, so sounds like you have a lot of anxiety and depression. Is that correct? Yeah, so anxiety symptoms are like feeling nervous, on edge, worrying excessively, overthinking a lot, or feeling something bad is gonna happen. Sometimes you even might have panic attacks. Panic attacks are like feeling chest tightness, shortness of breath, shaking, crying, impending doom, these type of episodes. Does it sound like those are the symptoms that you're having? Yes. Okay. And do you have panic attacks? No. Okay, good. Yeah, what about depression? Yeah, of course I can explain. Depressive symptoms are like you feeling tired all the time, you might have lack of motivation to do things, you have lost interest in things you used to like, you could have issues sleeping, like sleeping too much or sleeping too little, and in severe cases, you might even have passive or active suicidal thoughts. For example, you might have a feeling that you're better off dead, or you might even have plans to harm yourself. Are you having any symptoms like that? Yes. Okay. So currently, do you have any plans to harm yourself? No. Okay. And do you have any suicidal thoughts currently? No. Okay. Have you ever been hospitalized for your mental health before? No. Okay. And have you ever done anything to harm yourself in the past? No. Okay. Yeah, and how are you sleeping? Not very good. And how many hours would you say you sleep? So about 4 to 5 hours, but you're having a lot of issue falling or staying asleep. Okay. Yeah, so I kind of want to switch gear a little bit and ask if you have ever had any traumatic experience in the past. And if you feel comfortable, you can share what's the most traumatic experience you have had. You don't think so? Okay. So you don't think there are any particular events in the past that would cause any nightmares or flashback in your life? No. Okay. Yeah, and this is more like a screening question, but I do want to ask if you have ever had a manic episode. So I want to define what that means and you can tell me whether you ever had one or not. Is that okay? So manic episode is like a period of time when you're feeling extremely good, like a euphoric feeling. And during that time, you might feel a lot more energy than normal to a point that you feel like you need less sleep. And during that time, you could feel a lot more sociable, a lot more talkative than normal, or even having way higher self-confidence. And you could be doing impulsive behaviors such as spending money excessively or cleaning excessively in the middle of the night, just for examples. So in your whole lifetime, have you ever had an episode like that? You don't think so? Okay, good. Yeah, the reason I ask this is because it's really important to figure out whether you just have anxiety depression or you have something we call bipolar disorder. Because the treatment is going to be completely different. So it's really important to make an accurate diagnosis right off the bat. And anxiety depression are mainly treated by antidepressants, while bipolar disorder is treated by mood stabilizer, which is a completely different class of medication. So it's important for us to know. And if you do have bipolar, the pattern will be looking more like you have a manic episode that could last for days with the symptoms I described. And then after that, you crash. You become a lot more depressed, anxious, and irritable. That lasts for some time, and all of a sudden, you might have a manic episode again. So a lot of extreme mood swings. Versus people who just have anxiety depression, they would never have a manic episode in their lives. And have you ever had any hallucinations, like hearing voices that are not there or seeing images that are not there? No, you never. Okay, great. So based on everything that we discussed, it sounds like general anxiety disorder and major depressive disorder are the conditions that we want to focus on today. And the first line treatment for anxiety and depression are usually SSRI. It stands for Selective Serotonin Reuptake Inhibitor. And the most common examples are Zoloft, Lexapro, Prozac, these type of medications. So if you've never tried anything, I would suggest Zoloft, for example. And there's really no right or wrong answer which one you want to pick. Sometimes it's a little bit of a trial and error at the beginning. Zoloft, for example, maximum dose is 200 milligrams, and we usually like to start low and go up slowly. We give some time for the medication to work. It could take 2 to 7 weeks to work sometimes, so we gotta give it some time. It's not gonna work right away. And most common side effects may be nausea, dizziness, headache, but if it works for you, you shouldn't have any side effects. And sometimes your body might adjust to the medication and your side effects might go away after the first couple weeks. Is that something that you wanna try or interested in trying? Yes. Okay, great. Yeah, I mean, research has shown that it's much better with therapy and medication together. Since you're already doing therapy, I think it will be a really good move for us to try the medication as well. And of course, medication is just one part of the intervention. There are a lot of other strategies that could be helpful. For example, exercising at least 30 minutes a day, or eating well and sleeping well, and improving on your self-care. Those are really important as well. And of course, seeing your therapist regularly. Yeah, great. Do you have any questions? Okay. Yeah, so I'm gonna send you the medications and then I'll see you in a couple weeks and we can follow up with that. All right? Okay, well, nice meeting you. You take care. So that's usually how a psychiatric evaluation goes at my practice, and I hope that gives you an idea of what it's like to see a psychiatrist for the first time. Of course, this is just one example and it's not medical advice, so make sure you go to your provider and have the evaluation done. If you enjoyed this video and you're thinking about trying anxiety medication, you can check out this video. This video will explore 5 things you must know before you take your first dose of anxiety medications. Thank you so much for watching, and please comment below and tell me what questions you have and what videos you would like to see in the future. And I will see you in the next video. Take care.